Welcome to Accelerate My Practice. Glad you could join us here today. We today are going to be talking about the hygiene handoff. The challenges we run into is that oftentimes what happens is when we're doing a hygiene appointment, we're often chatting about stuff, life, right? Whatever's going on in life. And the challenge is then in the last 15 minutes of the appointment, when the doctor shows up for the exam, if we haven't prepped that patient at all for what's going to be found out or presented in the exam, what's the psychological profile of that patient when all of a sudden, in the last 15 minutes of the appointment, I tell you, Shar, that you need $2,000 or $3,000 of dentistry?
I think I would be shocked out of my mind that you've been chit-chatting with me this whole time and not really prepping me for what you're seeing.
So the challenge then becomes is, depending on the personality type, if you've got Shar sitting in the chair, she's going to be like, Doc, you're going to sit right here and you're going to answer all my questions. And now, you're 15 minutes into your next patient. If you have a more timid person in the chair, their answer often is going to be,
I don't know, I'm not timid.
Dumb setup there. Their answer often is going to be, let me think about it. And the reason why they're saying let me think about it is because they can't make a decision on the spot. They feel overwhelmed, they feel pressure, they have a million questions, we haven't gotten the questions answered. And so they walk away feeling insecure about making a decision. So what we often suggest by contrast is if we can do all the diagnostic stuff in the first 15 minutes, do your probing, do your exam, do whatever it is, x-rays of course, looking at all these things and then starting to prep the patient for what you think the doctor is going to see. And I think what will happen is you'll see a massive transformation in terms of case acceptance. Because now what all the doctor has to do is come in and reiterate what's already been said. And, with his little magic wand, like this one here, I actually carry a magic wand just for fun, viewpoint of what's the psychology behind it and why is it more effective or not effective depending on how it is you're doing it right now.
Right. And the other thing is, you're creating that communication transparency, right? Between the hygiene and doctor, you guys are basically working together as a team to properly treat the patient. So nothing seems like it's a shock, right? It's almost like going to the doctor for a second opinion, going to a different doctor for a second opinion. Instead, you have two opinions sitting right there in front of you. You've got the hygienist who's working on the patient, and then you have the doctor coming in who is agreeing with the hygienist of what's been presented, and maybe there's a little bit more that has to be presented, but at least there's some type of transparency with what you guys are seeing.
In addition to transparency, consistency is the key.
Absolutely.
So if one person tells you this and then another person tells you that, it's going to erode confidence in a big, big way.
Yep.
And so we all need to be on the same page, or at least we don't have to be at the exact same point, but we at least need to be on the same page, metaphorically speaking, or I think it'll massively erode the patient's confidence.
So great question to ask is how does this work for the hygienists that may not feel as confident to diagnose or co-diagnose? So
great question there. And here's what I would suggest. So we are on the same page. If you don't feel like you are, I would suggest you take some x-rays, some intra-oral photos, lunch hour training, hand them out to everybody. Have everybody write down and commit to what they think doctor's going to say. Everybody, assistants, front desk, everybody. Because again, I want that consistency and transparency. And the best way to have it is for everybody to be on the same page.
What about the opposite scenario where the hygienist would like to co-diagnose more, but the doctor just doesn't have the confidence in his hygiene team?
So in that case, I think, again, this whole training aspect of making sure that the doctor has the confidence that we're going to get it right is very, very important. So that exercise of here's a whole bunch of examples, everybody write it down, and if we don't get it right the first time, and there's now great discussion about how we're going to do it differently, then what we would do is go back a week later, do the same exercise, different patients, different scenarios, and see if we continuously get closer and closer and closer. And then, of course, in the mouth, we're getting to see this every single day with every single patient. So you get to practice 8 times a day with all your patients per hygienist. So now when doctor comes on in for the exam, walks up, says hi, shakes Char's hand, how you doing, does all the niceties. As soon as they say the hello, how are you doing, doctor, here's what I see in Darren's mouth. that I think you need to look at. I think you're probably going to recommend that Darren has an MODBL on this tooth and a crown on this tooth and maybe some periodontal disease, and this is what Darren and I have been discussing. So now the patient hears you say it twice, because they heard you say it to them and now they heard you say it to the doctor. Now doc can wash his hands or do whatever he wants to do, have some more small talk while he's kind of sizing up the scenario of this patient, how they're feeling, how they're acting, how is their body reaction to what the hygienist just said in front of them.
So in order for this to be successful, it's important between doctor and hygienist that you guys have I guess a good business plan together of expectations of, what the doctor would like to see, what the hygienist would like to do, making sure that you guys in the background already know what expectations you want to set, what the type of discussions that you want to have with the patients where you're co-diagnosing. So it's going to be important to make sure that you guys spend that time to understand what partnership you guys want to have in order so you can, capture as many opportunities as possible with the patients that are sitting there who need a treatment plan.
Any other concluding thoughts you want to throw in?
No, I think just come together as a team. Make sure you know what's important. Make sure you guys are working together as a team on this. That's what's going to make this successful for you.
Awesome. I hope you enjoyed the show. If you have any further questions, get a hold of your coach. Shoot us emails. If you have content you want to see us do in the future, please email it over to us. Otherwise, have a wonderful day, and we'll see you next week. 8 a.m. Mountain, 10 a.m. on the East Coast. Have a great week.
Bye.
What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.